Welcome to Rumor Has It, the podcast that busts myths, highlights evidence, and inspires hope for those living with rheumatic disease.
Through plain language interviews with experts, we offer actual knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl.
Join us as we bust myths and spotlights evidence.
Yay, so today we are so happy to have Dr. Cuoghi Edens here to help us talk about myths and facts about vaccines when it comes specifically to rheumatology patients. So welcome, Dr. Edens. Can you just let us first know a little bit about your training and your current work?
Sure. I'm a little bit unique in that I'm trained to see both adults and kids with rheumatic diseases. So I did my medical school at University of New Mexico, where I'm originally from. Then I did a combined adult and pediatric residency at University of Michigan in Ann Arbor. Then I did a combined adult and pediatric rheumatology fellowship in Cleveland. And then I'm now a assistant professor at University of Chicago, where I've been for the last 7 years. So I have pediatric training, which is a lot of infectious and preventing infectious disease training as well, but certainly have adult training as well. So I think that makes me also unique to talk about vaccines, because to me, those are things that kind of cross the spectrum of ages.
That's amazing. You're already like one in a million being a pediatric rheumatologist, and then also having being an adult rheumatologist too. I don't know how many people there are that have that. So we are so happy to have you to speak to these things.
I also want to say that I advocated for you to be our guest because of how much schooling you have gone through. And I've had the pleasure of actually meeting you in person at the American College of Rheumatology conference as well. And that's where you told me about all your training. So I was definitely impressed. And so we are going to jump into the first question today, which is one of the most common misconceptions that I keep encountering is that vaccines are harmful and natural is better. Why is this myth harmful, and what are some ways you combat this in the clinic when talking one-on-one with patients?
So I think this idea of natural has some really good value and merit to it. There's a lot of things that we should kind of get back to basics on. But also, if we look back and say, what did happen before we had vaccines or before we had other things that some people may consider unnatural? For example, antibiotics. People didn't live for very long. The people used to have multiple children, not because there wasn't birth control. That was one reason. But the main reason was actually that they needed so many children to actually be able to, have enough to go into adulthood, because the child mortality rate used to be very high. And part of that was actually due to vaccine preventable illnesses and infections. And the same thing can be applied, to adults as well, in terms of adults didn't live for very long because of infections that, now we're doing an excellent job of preventing or treating. I think when we think about vaccines and how to treat some of our rheumatic diseases and some of our infections, that a lot of us have seen what it looks like to not have treatment or to have people treat things naturally. And unfortunately, it's not very pretty.
Yeah, and I know both Eileen and I have talked about like family members we've had that have had rheumatic diseases prior to this current era of the, quote unquote, unnatural medications that are so effective and putting the disease in remission. And you only have to go back a few decades and see how life-changing some of these interventions are. Back to vaccines, one of the other things that unfortunately has been in the news a lot is a lot of misconceptions around things maybe quote unquote being caused by vaccines. Like there's this erroneous idea that vaccines caused autism, which has been debunked numerous times. And lately, I've been hearing more and more people speculate or believe that their vaccination caused their autoimmune disease. And from your training and your expertise, is this a myth or is this a fact?
So to me, it is largely a myth. I certainly will not put it past that when we get a vaccine, our immune system is activated. And when our immune system is activated, again, whether it's from an infection or some other process, it does have the potential to go a little haywire. So I think to say like, no, that never happens is really discrediting it. Some of the research out there that does really show that maybe there is a very, very small incidence of autoimmune diseases after vaccines. However, when you think about the numbers of people who are vaccinated in the United States as well as across the world, if vaccines cause autoimmune diseases, there would have to be hundreds and thousands more rheumatologists and GI doctors and endocrinologists to help take care of all the autoimmune diseases that would be caused by vaccines. And so, again, I think there are really rare instances where that does happen, but I think overall, it's very, very, very unlikely for someone to develop an autoimmune disease from a vaccine. And again, I think we know that just looking at the population and the incidence of our diseases over time.
That makes sense. Thank you. Yeah, if it was the only thing that caused autoimmunity, everyone who got vaccinated would have an autoimmune disease, which is not the case. So
yeah, there are also people, who are not vaccinated, whether that's for personal reasons or, whatever the reasons may be, who still develop autoimmune diseases. And so, again, that really shows that vaccines are not really the neatest to the autoimmune diseases that we know of.
Yes, I was diagnosed with rheumatoid arthritis before I ever even knew of COVID-19 and before my very first flu shots. So we're going to go into another myth about vaccines, again, kind of going on and about the symptoms. Can you let us know if this is a myth or a fact? Vaccines always cause flare-ups or worsening of existing rheumatic disease symptoms.
So I think this is a big challenge because I think when, again, vaccines have the potential to definitely kind of stir up people's immune system. And that's like literally their job, right? They're proteins that are, typically bound to something that makes their immune system react. And again, most patients with autoimmune diseases have an immune system that's already overactive. And then we give people medications to actually kind of like turn down the volume of their immune system, is kind of how I talk about it with my patients. And so I think that, yes, there is a potential for a flare up. And again, if a patient tells me, like, I had whatever vaccine that it was, and I felt really horrible for like the next week after, or they call me and say, like, can I get some prednisone? I'm doing really poorly. I don't discount that personal experience for them. But again, I look at my practice as someone, who takes care of hundreds of patients with rheumatic diseases. And to me, most of my patients, when we've looked, do receive their vaccines. And very few of them actually have any sort of flare up after receiving them. So again, I think it is possible, but in the research that's out there, and then my own personal clinical experience, again, across the ages of rheumatology patients, I think it's very low likelihood that a flare up would happen after a vaccine.
that makes a lot of sense. And it reminds me of the phenomenon that I've experienced too, where just getting sick from whatever, because my immune system is being activated, can actually potentially cause that flare up too. So potentially, would it be correct to say it's not really the vaccine necessarily, it's just the fact that you're stimulating, for lack of a better word, your immune
Yeah.
system?
I mean, again, like we know, like surgery, stressful events, travel, we know that all of these things can, also cause people to flare. So I agree. I think a vaccine is in the same category as all of those things. To me, a vaccine is very beneficial. And so I think you have to outweigh your risks. Obviously, if you've had one flare before, then that's going to make you a little maybe less likely to want to receive other vaccinations. But I think that's also important to remember that like every vaccine is not the same. I personally, don't feel very good after my COVID-19 vaccines. I usually have to take a day off of work the next day or kind of relaxed, versus like the flu shot, I'm fine and I don't have any issues with it. So again, I think there are certainly differences on how you're personally going to respond, and you just have to realize that.
I definitely want to just agree with that and say, like, as a rheumatic disease patient, when we have our infusions, we kind of know that we're going to be feeling horrible for a few days after. So it's kind of just as you adapt and get used to living with a rheumatic disease, you know that sometimes the medications aren't going to make you feel so good for a few days, but that will pass. And you learn how to kind of navigate it in your schedule.
Right. And again, I think for you, the benefits of your medication outweigh, the day or two where you may not feel up to your full self.
Exactly.
Yeah, and thinking about it as the cost benefit analysis, I think is so helpful when you're looking at vaccines overall, right? Because you're not just looking at the potential of maybe a short-term flare-up post-vaccine, but you're looking at what's the potential risk of getting this communicable disease, right? Getting polio or getting measles. That's really bad for your immune system,
Well,
right?
and certainly the flu flares up many people. Unfortunately, COVID-19, I think if anyone talks to someone who has long haul COVID, they would not want to be in that person's shoes. And I think just thinking about that as well is like trying to prevent some of these diagnoses that can also flare up your autoimmune disease as well. So, and I think that's important. I think also, we have two vaccines that prevent cancer. I think that gets like very underlooked at and kind of just forgotten that we have the hepatitis B vaccine, which was and worldwide is still like one of the number one causes of liver cancer. And to me, to be able to vaccinate children and adults against that is huge. A huge decrease in liver cancer related to it. We also have the HPV vaccine for the human papillomavirus, again, which is the leading cause of cervical cancer. And the rates of cervical cancer have just plummeted as we've been implementing this vaccine, and not only in the United States, globally. And again, really important for places in the world that may actually have a lot less access to women's healthcare screening and things like that versus the United States. So again, I think, yeah, your disease flaring up is an unfortunate and rare issue, but preventing cancer, I think, is really important. And again, we actually know that patients who have autoimmune disease are at increased risk for some of these cancers anyway, that these vaccines are preventing.
Yeah, that's incredible. The next myth, you've kind of touched on this, but just to drive the point home, the myth is that vaccines are unsafe for people with rheumatic disease. Is that true or false, or is there some gray area? Like, are there some people who aren't able to get a vaccine who have an autoimmune disease?
I would say there's a very rare small population that cannot get certain vaccines. But I think if a patient tells me, like, I can't get any vaccines because of my autoimmune disease, then to me, that's some time for me to spend with them and really dive a little bit deeper into why they have this idea. I kind of think of it like, so many people are penicillin allergic if you look at their medical records or if you ask them, but it's like, something happened when they were 5 years old and they have an ear infection and they got a rash, and like their parent has just continued to tell them for their whole life that they were allergic to amoxicillin. And probably they're not. Probably the rash was from a virus and they didn't really have an infection anyway. So again, I think when we kind of give these blanket statements, I think we just need to delve a little bit closer. Maybe someone did have a reaction as a kid, to the whooping cough vaccine, for example. But again, that shouldn't like characterize all vaccines for the foreseeable future for their life.
Yeah, that makes a lot of sense. Thank you. I think Eileen has the next question.
I do. Another question we have is about the timing of rheumatic disease medications and vaccinations. In my experience, I'm on rituximab, so I can only get vaccinated actually twice a year for COVID-19 and the flu vaccine. I have to time it quite around my biologics. So, is that something that you can kind of tell us a little bit about? When is somebody recommended to kind of hold off medications and vaccines? And I guess some things that they can do to kind of communicate that with others so that they understand.
So, the American College of Rheumatology, which again is like the overseeing organization of all rheumatologists in the United States, has some vaccine guidelines that are actually fairly helpful and do address a decent amount of this. I will also say that there is a difference between live vaccines versus non-live vaccines, and some of that also comes to the timing as well. So for live vaccines, we try not to give those for patients who are on any sort of immunosuppressive medication, but most of the live vaccines are not given to adults. They're given to young children who are under the age of 6, with kind of the measles, mumps, and rubella vaccine kind of being the most famous of them, and most recently, of course, in the news with our increasing measles numbers. So, why do we care about people getting vaccines when they're on rheumatology medications if they're not a live vaccine? And that's because we worry that if we give a vaccine, we want someone's immune system to respond and to make antibodies and mount a response so that if you do come into contact with the flu, that your body has the ability to respond to it. I think sometimes like making sure that the vaccines are timed appropriately is maybe a little bit, especially for things like rituximab, like yours. To me, like just I vaccinate my patients no matter like when they got their rituximab versus not, because I think I'd rather them be slightly vaccinated than not vaccinated at all and kind of like miss the season for some of the vaccines. And again, getting flu, COVID, any of these can like certainly flare up their autoimmune disease as well. So I think that's important. I will say high doses of steroids. So the ACR guidelines say over 20 milligrams of prednisone a day or the equivalent of that. Or is also maybe we should think about, holding the vaccine until we can get someone on lower doses of steroids. Again, and that's really just to make sure that their body can form an appropriate response. But if someone's on 60 and they're not going to be below 20 milligrams of prednisone until we're out of flu season, then it doesn't make sense to wait for that patient. And to me, even like the small amount of protection that they can get on a high dose of steroid is worth it versus them not getting vaccinated at all.
Thank you for clarifying that. And I actually really appreciate that you did bring up rather get it so that you miss that wave because I'm not due for mine until December. And that's like when everything's already kind of full bloom and done. So yeah. All right. So now we are kind of jumping into what I'm going to say is my favorite myth, stigma, misconception about vaccines, and that has been going around quite a bit in conversations with people. I was in the media a bunch about vaccines, and I got even people telling me I should die just because I was pro-vaccine. So it's quite interesting to see where the hatred and like the anger for people who are pro-vaccine has gone. And I've been seeing people lately who are calling vaccinated people weak or sheep, and they're just listening to the masses. This is something like I've seen on dating apps where men will say things like, I won't date a natural unvaxxed woman or pure blood only. And people like Andrew Tate promoting that kind of attitude. I'm just curious. What is your opinion on that? And like, how would you kind of smash that stigma?
I mean, I think we've used a lot of these terms to become very polarizing and hurtful. And to me, again, these are sometimes conversations that are not worth having. You're not going to change that person's opinion. And it sounds like also not someone that you'd be interested in dating. I think people are using vaccines now as like a very polarizing topic, and it's unnecessarily so. I think we follow all sorts of things, right? If you buy your groceries at the grocery store, is that like being a sheep when like maybe you should be like growing your own corn?
Yeah, yeah. I do think that there are people who are so off the deep end, like you said, that you're not going to see eye to eye with them. But I think there's room for helping people develop some of the tools of basic like scientific literacy or health literacy. For example, actually, I remember the moment I learned about correlation versus causation. And that was in my statistics class my freshman year of college. And I was like, whoa, this is actually blowing my mind. Like, I realized there have been so many errors in my way of thinking because I'd think, well, if two things go together, then the one thing must have caused the other thing. But then the teacher had us do this thought experiment where it was like, well, if, every time you see rain, you see umbrellas, then did those umbrellas cause the rain or did lack of umbrellas cause the lack of rain? You're like, oh, no, duh. But then we realized we apply that logic around vaccinations and maybe the onset of symptoms or traits of autism coming out around certain times. And people are realizing correlations that are actually just two variables that happen to be going at the same time. in the case of autism, like I can put a little chart in the chat, the autism rates have risen identically with avocado consumption in the
Yeah,
US.
yeah.
They've risen identically with cheese consumption, with yoga, with coffee, with all these things are just random correlations. But I think it's hard for people's brains to see that. So sorry, Eileen, I think you wanted to say something too.
Yeah, just piggybacking on the whole following the masses and listening to other people kind of thing like that. We are listening to other people. We're listening to the researchers, the scientists, and the clinicians, just like Cuoghi here, who has far more education than some of the people that are putting these vaccines down. So I always find like, yeah, I'm following my healthcare providers that know a lot more about my condition than somebody else who doesn't know a thing about my condition.
I always love the doing your research term because, I do research, right? So that means I'm gathering data, I'm analyzing, I'm publishing, and, someone else can find that data and read it. I don't specifically do vaccine research, but I do research in other areas in reproductive health and rheumatology specifically. So when people always say, like, oh, I did my research, and I'm like, looking online for other articles is not doing research, it's
Yeah.
just reading. Researchers are people who are gathering the initial data, and that's who is writing manuscripts, and then you as a consumer of those, whether you have training or not, is that's you're not doing the research. And so I always kind of point that out when people are like, well, I did my research, and I'm like, okay, did you have a lab, like, you work at the
Yeah.
university? That's great. And
Yeah.
again, it's a little bit tongue-in-cheek, but I think it didn't, again, drives home that point.
It's no, it's an important nuanced point. And like I think both Eileen and I, we know that patients who are activated and who like want to actively research their care and their treatments are that's a great thing, right? But not all research is created equal. Cherry picking data, finding the one study that supports what you want that to believe is not the same as actually being able to critically assess like a wealth of, peer-reviewed literature.
Yeah.
So,
And I just want to comment as a member of the Arthritis Research Canada Patient Advisory Board since 2018. I have communicated with many researchers. I've been to the Canadian Rheumatology, the European Rheumatology, and the American Rheumatology conferences.
mhm.
I would honestly never second guess these researchers and what they do when I'm just comparing it to YouTube videos or doing my
Yeah.
own research because these people are trained in doing proper research. And I don't think people really realize how vigorous the research process is.
They don't. No, most patients don't. But yeah, so just for sake of time, and this is something we could, I know, both talk about all day long. I do want to put a quick plug. I did have a podcast episode with one Dr. Dave and Dr. Campbell. One's a PhD researcher in immunology, and one's a rheumatologist, which was what do people with rheumatoid arthritis need to know about COVID-19? This was in 2024. And that's all about specifically like the safety and efficacy of the COVID vaccines and how they work and stuff like that. So I recommend listening to that one too. But for today, we're going to wrap it up with you and ask in one sentence, what is the most important takeaway you would want a listener to take from this episode?
So in patients who have rheumatic and autoimmune diseases, vaccines are, to me, a pretty essential part of your care because you are often immunosuppressed, and overall they're safe and really don't have any evidence that they cause flares. Importantly, also we have vaccines that prevent infections, but we also have vaccines that prevent cancer, and autoimmune patients are already at risk for those. And so I think that's, to me, was some of the pearls. I think we have no evidence that vaccines are unsafe. We have no evidence that vaccines cause autism. And I think very, very, very little information that vaccines cause autoimmune diseases. And so we should get vaccinated with confidence. Obviously, I encourage everyone to talk with their healthcare providers about vaccines. There's a ton of great websites out there. I will say for people who are concerned about the additives in vaccines, the Children's Hospital of Philadelphia actually has really great information going through each of the different additives that people may be concerned about either currently on vaccines or historically. But there are very reliable vaccine sources out there. And again, I think if you have a healthcare provider who's also telling you not to vaccinate, then I would also just question why they're doing that and potentially like putting your health or others in jeopardy.
Absolutely. And I think you summarized the key takeaways of this podcast episode perfectly and the message that we were trying to hopefully get out there. I really appreciate that you've taken the time to explain it all and to put yourself out there like this. So, if people wanted to connect with you or learn more, where do you recommend they go?
Sure. So certainly I'm a part of our American College of Rheumatology, so I could be accessed there. Again, I work at University of Chicago currently, and I certainly have a website there that also has my contact information. It also has my background and my publications and current research as well.
That's so wonderful. Well, and thank you again for coming on. This is a hard thing to talk about, I know right now, just given the discourse, let's just call it that. But thank you to those who are listening and who made it to the end of another episode of Rumor Has It.
Thanks for so much for having me. I really appreciate it.
Yes. Don't forget to check out the show notes on the Arthritis Life website to get links to everything we've discussed and to know that we've included lots of reputable resources for you to understand vaccines.
100%. Thanks again, and let us know via social media under, Chronic Eileen or Arthritis Life Cheryl if you have any topic ideas for future episodes. Bye bye for now, and thanks again, Dr. Edens. Yay!